In the month of May, we have the opportunity to recognize all the professional men and women who provide healthcare services on behalf of the communities that we serve throughout central and western Maine. In my very short time at Central Maine Healthcare, I've had an opportunity to hear many great stories about the sacrifices and great quality that many of our professional nurses provide throughout our health system. In this month of May, let's recognize all of you for the tremendous work that you do on behalf of our communities.
I love being a nursing supervisor because I really enjoy supporting the people who are directly taking care of the patients. I believe that in taking care of those people the way they need, they will give back and take the best care of our patients.
I love being a nurse because I love the patients mostly. I love taking care of people. I like seeing them get better.
I love giving patient care. I believe that we give the best care here, and my care is focused on compassion.
Helping families, and for this floor specifically, I love bringing new life into this world with people and being a part of their, some of their best times in their lives.
I grew up in a family of nurses, and it sort of seemed like it was my predestined journey in life. I love taking care of people and helping people.
I got into it because someone treated my mother poorly, and I swore that wouldn't happen to anybody I touched.
I love being able to help our patients and hope that I make their experience a little less scary for them and get them feeling better and, you know, back to their families and their loved ones.
I've always wanted to be a nurse since I was small, and that was my goal, to someday become a registered nurse.
I love being a nurse, especially on the rehab unit, as we get to see the patients progress from needing a lot of help to being able to send them home walking out the door.
And we're really all here for the same purpose, which is the patient, and to make their experience the best it can be.
I love being a nurse because, and I know it sounds cliche, everybody says this, but being able to bring that quality care close to home and taking care of the patients that we know in our communities.
We all have a passion for what we do, and I think that's what makes working worthwhile.
You know, nursing is going to be something that will really help fill my needs to achieve being a people, I work for people, and I went to school, and that's how I became a nurse.
I love helping people, and especially on the rehab unit, giving them back their autonomy.
I love being able to care for someone when they need it the most.
I love the patients. I love the teamwork. I love the group of people that we work with, and the doctors, everything.
Gives me a chance to meet people in the community and provide care when they need it the most.
I just find it to be a privilege to be allowed to take care of people at their most vulnerable and sometimes most difficult time in their lives and help them through that.
The patient care and interaction with people, you know, is a big part of my day, and it's a big part of the reason that I do what I do.
I've always wanted to be a nurse. I always knew I was going to be a nurse when I was little, and it's just a great way to spend the day, to give back to others and watch people get better.
I grew up in a family of 9, so my mother instilled in us a work ethic in taking care of others, and I'd have to say that I do owe it all to her, and she is my mentor.
Well, I love helping others, helping them get to where they need to be, whether it be back into the community, whether it be to a long-term care facility, wherever, helping them reach their goals.
I enjoy taking care of patients, helping others, but that's like, sort of sounds cliche, but it's true.
I love that you get to interact with people at a time in their lives where, you know, I mean, they're very vulnerable, and you get to help them as best as you possibly can.
I think a lot of us get into it because we want to connect with patients and their family during really difficult times, but it also gives us an opportunity to stay really cutting edge with what's the most recent evidence-based practice for taking care of this person? What's the scientific rationale behind what we're doing to get this person better and home? I think it's the best aspects of the heart and the science of medicine combined into one.
I wanted a chance to be at the bedside. I wanted to work with patients and help them through some of the more challenging times in life.
Everything is always changing, and there's always better ways to provide that care to the patients, so it's an exciting field of work to be in.
And I love every bit of what I do. Doesn't mean it's not hard, but I really love it.
I was in nursing school when I had my first baby and not here, and I had a really bad experience. So from that point on, that I knew I wanted to be an OB nurse and I wanted to make everyone's delivery much better than mine was.
Well, I love people, and just making the connection with people and being able to help them is just very rewarding.
We work as a family. People respect each other. We understand that we're here for patients, but we also understand that we need to be here for each other. And we do. We take care of our patients very well, and we take care of each other very well.
Sometimes people ask me, how can you do the same thing for that long of a period? And I've not done the same thing probably for more than 10 years.
You're taking care of patients every single day that most of them are here, not by choice, but you're able to make that experience a little bit better.
I love being a nurse because you get to help people. So every day you get to see, you know, how people get better and help them troubleshoot things.
You know, a lot of the time we're seeing people at kind of the lowest point in their lives and being able to help them get back on their feet, and then seeing them being able to get better and go home is very rewarding.
I like working directly with the patients. I like helping them achieve their goals, to come in one state and to leave in a better state.
I love that I constantly am meeting new and different people, and I actually feel like I make a difference in people's lives. Like, I make people smile, and I get thanked on a daily basis, which is an awesome feeling.
I love being a nurse because it gives me contact with patients who need, in this current position, they need help learning how to live with heart failure.
The integrated nature of Central Maine with the community around us, and just the impact that we kind of feel every day as a flight team, and working around in the hospital, in the ICU, and in the emergency department.
I love being a nurse. I've always loved to be a nurse since I was a young child. And just to be there with the people, I know we are there when their times are hard, but to see them change from worse to getting better.
Thank you all for everything that you do. I want to not only thank the nurses, but also the providers here. Everybody just is really about patient-centered care, and that's the message I want to give, is thank you for the care that you give our patients.
Nursing is a passion, a drive, a commitment, a dedication, a caring for our patients and our community. I want to thank each and every one of you for making a difference to our community by providing safe, quality care each and every day.
I wish to express my pride in being a part of this nursing organization here at Central Maine Healthcare. We have a group of very talented and dedicated nurses that provide outstanding patient care to the members of our community. And we should be very proud of what we can provide to our community here at Central Maine. Your dedication and efforts on behalf of the patients and families of Central Maine Healthcare are very much appreciated. I wish you all success, and as we move forward and continue to provide outstanding health care to our community.
To each and every nurse across Central Maine Healthcare, thank you so much for what you do. What you do is more than a job. It's a calling. It's a service, and you do it in an exceptional fashion every single day. Without you, we are merely buildings. We are merely another organization with no real purpose. But with nurses, we provide care, we provide life, and occasionally we help people die. The compassion you bring is nothing short of amazing. So for all of you during Nurses Week, thank you so much for the great work you do.